Fantastic. Yes, it's a great pleasure for me actually to be here and to talk to you. As Lorenzo mentioned, we tried to have a grant application together, but it didn't turn out in the end to realize. But I realized that you have some interest in working around planetary health and other topics related to human health in relation to the natural world and so on. So I hope and believe that we can get some collaborations going in the future. But today I'm going to talk mostly about the research I've been doing before up to now, and I wasn't quite sure how much research or how much work you have been doing around urban green spaces and human health. So I thought I'd give a very quick background to that as well. So what I want to talk about, if I could change the slide. So yes, more trees and less medicines to keep people healthy. That's the theme of today. But now I can't change. All right. Yes, so I would say that I have a little bit of insights in this. I used to work as a physician. My background is in medicine, and I used to work at the University Hospital of Lund. It's the beautiful building you can see here, built in the grand era of the 60s, and I don't know what you think, but to me, it's sort of a hostile environment, not really health promoting. And I was healthy working there, but I was thinking the patients who came is not really a health promoting view or welcome to enter when you're already suffering from sort of illness. In addition, I perceived when I was working as a doctor some sort of frustration, or quite a lot of frustration, because my education was not perfectly suited, perfectly fit for the kind of diseases that my patients were suffering from. There was a lot of lifestyle-related disorders, environmentally related disorders, many chronic diseases that once the patients came to the hospital was often too late, in the sense that the disease condition was already there, and it would have been made more sense to do something about it before this illness actually happened. So after some years working there, I got more and more inclined to take my interest for the environment more seriously, and especially the natural environment. And that's when I also came across a very interesting study by Roger Ulrich that was published in Science 1984. So it's an old study. It's sort of a groundbreaking, pioneering landmark study within the field of nature and health. This was a retrospective study. He looked at the medical records of patients that had gone through gallbladder surgery and looked at the rooms where these patients were recovering after the surgery. And half of the patients basically were recovering in rooms where there was a view towards a park with greenery and trees and so on. And the other group was recovering in rooms where there was a view over a brick wall. So this was basically the only difference between these two groups, although it was a retrospective study, as said. What he could read from the records was that those who had views over green spaces used less strong analgesics. It seemed like there was something with the view of green spaces that buffered the pain and the challenges and the suffering after a gallbladder surgery. And in addition, it doesn't say on this one, they also went home, like I think almost a day earlier on average from the hospital compared to those that were had the views over the brick wall. So it sort of suggests that even just having a view of green space can have some sort of beneficial impact on patients' recovery from surgery or disease. Right. So this is when I actually left the hospital and moved on to this beautiful campus of the Swedish University of Agricultural Sciences. So I was sort of taking my interest and actually walking the talk or living what I was working on. So this is Life Science University, and I got eventually a PhD in landscape planning and public health, working interdisciplinary between the environmental sciences, and I was working a lot with the forestry department as well. So after a few years working as a researcher there, I moved on to another beautiful campus, the University of British Columbia in Vancouver, Canada. It's a fantastic setting with the mountains and the horizon. You can see them like 3 times a year when it's not raining. No, sorry, British Columbia and Vancouver are beautiful settings, but the climate was not really to my liking. So in spite of the beauty there, I worked as an assistant professor at the Faculty of Medicine and the Faculty of Forestry. So again, this sort of interdisciplinary work, which I'm passionate about. Anyhow, my desire for a nice climate brought me to Barcelona in 2020, where I'm working at ISGlobal, the Barcelona Institute for Global Health. And as you see, the institute is situated basically on the beach of the Mediterranean Sea. So we're very happy there. It's a great environment, and I'm keep on doing research around mostly urban green spaces and blue spaces and different health outcomes. I will talk more specifically about my own research later. This was just a little bit of a background to who I am, and also because I think my personal journey sort of reflects the research and the results we are working with in this field. I've been working mostly with urban nature, urban green spaces, because that's where most people live. You know, we all know that more than 50% of the global population live in cities. We have now reached the 8 billion. Couple of weeks ago, we are 8 billion people on Earth, and the majority live in cities. And I'm interested in how we can develop healthier cities, since we expect the urban population to grow even further with the years. Yes, so I talked about why I didn't feel comfortable working as a hospital with the tools and the methods that we had from a medical perspective, because of the diseases my patients were suffering from. Because over the years, like the last century, the risk factors for disease has changed enormously. So what the reason why we're suffering from the non-communicable diseases that we talk about is chronic stress, physical inactivity, social isolation, the harmful exposures like air pollution, noise, heat exposure, loss of biodiversity, and all the issues related to climate change. And the point here is, I mean, these are not things we can do anything about I mean, we can treat people with antidepressants or whatever if they have chronic stress and get mental illness, but would be better to sort of address the condition at the root of the cause, so to say. And that is what we're trying to do from the nature and health perspective. A lot of these challenges, risk factors are related to urban living, the air pollution and sedentary lifestyles, and also images here of impacts of the urban heat island and so on. The nice thing for me when working around green spaces and nature and so on is that we can actually have an impact and transform the cities, because these are environments that are modifiable, and we can work around them to actually have an impact. And in the IPCC report, the recent IPCC report, they're talking about transforming cities and mentioning a lot around these, the nature-based solutions, establishing green and blue spaces, urban agriculture, and all this will have benefits for public health and also the ecosystems. So this is the key to me, that we can have these co-benefits, that by improving public health, we also can protect biodiversity, for example, and create healthier environment. If we sort of see the interactions, the interdependence between human health and the health of ecosystems, that is something that I think is very important to increase awareness around and to work around. And that is where the planetary health perspective is coming in, obviously. Right. Okay, so let's go a little bit into the research around urban green spaces and health. This is a picture from my walk to work in Barcelona. Barcelona is not really known for its urban green spaces, but it's not so many parks within the city, but we have a lot of street trees, which I think is a very important component of a city's green infrastructure. Anyhow, I'll put on the top here biodiversity, because without biodiversity, we don't have any of the services, we don't get any of the health benefits from green spaces. So this is the point. We need to keep the ecosystems healthy. Otherwise, we will not see any of these benefits that we see in research. I put here the ecosystem services. I will get a little bit further into that later, but they basically represent cooling of cities, for example, which will reduce heat-related morbidity and mortality. So there's some sort of separate research going on around that. And then we talk about a lot around the more socio-behavioral pathways, physical activity, social contacts, stress reduction. So these are all sort of pathways or mediators, depending on how we look at it in the models, basically, which we think explain the different health outcomes that have been associated to exposure to green spaces. And there are, I could give you hundreds of studies for each of these pathways. There is a lot of studies now. Over the last couple of decades, there has been an exponential research in green spaces and health. So we know a lot more than we did when I started working on this. For example, these are mostly findings from epidemiological studies. And many of these have included these pathways as mediators in the model. So there are many studies showing that there is exposure. People who have exposure or access to green spaces are at reduced risk of depression, cardiovascular diseases, and mortality, stroke, diabetes, asthma, cancer. You see all these chronic, non-communicable diseases that are sort of the lion's share of the conditions people suffer from today. The nice thing is that we also see from research, know from a lot of studies, that it's not only this disease prevention, but we can actually promote health. There are increased levels of mental well-being, happiness, academic performance among children, memory capacity, sleep quality, all of those things that we know are important for healthy lives across the life course. Excuse me. So I said I could give you a number of studies. I will just give you a few examples so you have some sort of trust in what I'm saying. This is a study published a few years ago by Thomas Astelbert and his colleagues in Australia. It's a sample of more than 200,000 adults, where they're looking at levels of physical activity in relation to the amount of green space and it eludes me the word. The reference level is where they don't have any green space. So you can see in the adjusted models with just a little bit of green space increase, we don't see any significant change in the physical activity levels. But as we move up along the line here along the horizontal axis towards more and more green space in the neighborhood, the chances of being physically active increase significantly, even also in the adjusted models up to 20%, 25% something, which would suggest that having access to green space makes people go out more and be more physically active. And this is also what we see with the social contact. People simply go out. If there is a nice green space, importantly, green space, people tend to go out and interact socially. Excuse me. Stress reduction, I also mentioned as one of the pathways. This was a study published in 2017 by Andrei Egorov and his colleagues in North Carolina, where they used biomarkers of allostatic load as an indicator of chronic stress. And they looked again at a land cover of green space, or using green space as the metric. And they found that with this, they had different categories of the allostatic load, depending on, some more or less missing data and so on. But they didn't see much differences. What we see basically is that there is a significant reduction in these chronic stress indicated in allostatic load among people who are in the highest tertile of green spaces, and also some impact in the second tertile, basically for all of those biomarker, allostatic load biomarker metrics. Yes, we can, if there is time, we can discuss why it would have a stress reducing effect later on. A nice study from the institute I am right now, ISGlobal, suggested that cities in Europe is a health impact assessment where they have used sort of a positive investment in green spaces as the impact which they calculated, they assessed the health impact from. So cities in Europe could prevent up to 43,000 deaths annually if they achieved the WHO recommendations on access to green space. And the WHO recommendation, I was working with them in 2016, and what we eventually concluded as a reasonable indicator is that everyone in the city should have access to at least a 1 hectare sized green space within 300 meters from the residence, and that would correspond to some 5 to 10 minutes walk depending on age and so on. However, it turns out that in the European cities, over 60% of the population has insufficient access to green space, which simply says that there's a lot to do. There's a lot for us to work on to keep on communicating this message about the benefits of green spaces, because we can really improve our urban environments by finding different ways to increase green spaces. This is another very important and interesting article that was published by Richard Mitchell and Popham in 2008, so it's pretty old by now, in The Lancet. It was one of the first huge population studies. I think it's 40 million. It's based on English data, registered data. So it's a sample of 40 million something, where they basically assigned to every inhabitant in England the level of green space in their neighborhood. And the interesting thing here is what we call the ecogenic effect of nature, meaning that in areas with a lot of green space, the differences, the socioeconomically related inequalities in health decrease. So what we can see is that the income group 4, those that have the lowest income, we see quite a significant or strong trend in decreased all-cause mortality with increasing access to green along the x-axis. We don't see that much of an effect of the green spaces in the wealthy, affluent populations, but basically what this picture wants to show, and the upper diagram is for all-cause mortality, and the other one is from mortality from circulatory disease, and they show basically the same picture. And what we see is that the gap diminishes. And following this study, a few other studies have looked again at this ecogenic effect, and the grand majority, with a few exceptions, as always, show the same, that the impact on already wealthy populations who already are usually of good health is not that large from green spaces. But this is interesting, of course, because this shows that our investments in green spaces, how we should plan our cities, is quite obviously to invest where it's needed the most. And this is why I mentioned before the nice green spaces. We should invest in high quality biodiverse environments in deprived areas to achieve the most health impacts. I cannot resist to show you this picture of the ecosystem services. It was published, or it was introduced in the Millennium Ecosystem Assessment from 2005. I like to present it because to me it's been a good way to communicate the services that the environment, that nature provides to us. And as I mentioned, at the bottom of it all is biodiversity. Life on Earth depends on biodiversity. And what I think it demonstrates pretty well is that we have these supporting, provisioning services that maybe are most important in the global south, in forest-dependent communities, for example, where provision of food, fresh water, wood, fuel, and so on are important for people's survival, basically. And then I mentioned the regulating ecosystem services like heat reduction and also air pollution reduction and so on. Then I would say that the cultural ecosystem services are probably as important, independent of where you might be, whether it's in a city or countryside, and where on the earth you are. We're talking about these aesthetic, spiritual, recreational services. And we know by now also from the WHO health definition that health is not only physical, it's not absence of disease, it's mental and social and also spiritual well-being have been included as well. So this is what we need to be fully healthy. And this is, of course, what this other side showed, the constituents of well-being that goes from security to freedom of choice and action. For us to live in civilizations as healthy human beings. All right, so this one also includes a number of arrows that show the different, the relative difference in impact depending on ecosystem services. But if you're interested, you have the link here to look further into that. So just an example, urban parks reduce heat exposure. I would say that's one of the regulating ecosystem services that there is most evidence on. There are a number of studies, and cooling intensity varies from 0.3 to up to almost 7 degrees Celsius, even higher or more heat reduction has been found in some studies. And I don't think I have any slide on this now, but this has also been related to reduction in heat-related mortality and morbidity and ambulance calls, for example, related to heat-related illness and conditions. So this is quite obviously something that is getting more and more important as climate change increases. And for this reason, it's interesting that in the Lancet Global Countdown and also in the Lancet European Countdown for Climate Change, one of the indicators that is now included since last year is urban green space. It's one of those things that they will keep on monitoring. And for this, in this, the countdown of last year, they had this measurement of normalized difference vegetation index, NDVI, which is just a measure of health vegetation or not. You have to start somewhere. So they found that globally in 2020, 27% of the urban centers were classified as being moderately green or above, which was a nice increase from 2010, when only 14% of the cities were classified as moderately green. Unfortunately, as is usually the case, a lower percentage of these urban centers with enough green were in the low income countries, while the majority of these moderately green cities were to be found in high income countries. I also copied this text from the countdown because it's interesting to see that here it's also acknowledged that green spaces, nature can improve health outcomes, reduce health inequities, and facilitate climate mitigation and adaptation. So urban green space design has to be incorporated, and we need interdisciplinary expertise to achieve these benefits and co-benefits, which are quite striking. You're in Italy now, so you have not much has changed between 2010 and 2020. It's actually low. Italy is low, but Spain is even worse, very low. This is urban population weighted, the indicator. So here we go. I said it's a positive picture, but this, and I also said there's still a lot to do from between 2000 and 2010. So this is a decade before. There was actually a net loss in urban forest cover in cities across the world. I think in this estimate, it was used tree canopy cover rather than the other green space metric that was used for the Lancet Countdown report. So we're talking about cities, and there are many good things with cities, but it seems that we know that mental health issues are more common in cities compared to the countryside, and it seems that that urbanites are more vulnerable to stress, which could be one of the explanations for the higher prevalence of depression and schizophrenia in cities. So this was a very interesting study by Andreas Lederbogen and his colleagues in Germany that was published in Nature 2011. And they were interested in exactly this thing to explain why depression was more or is more common in cities. So what they did was that they looked at this little structure in the brain, the amygdala, which is lightening up under stress, and in these groups they sort of had three groups of participants in the study. One group that was entirely rural, and one group that lived in small towns, and one group that lived in cities. And what they found after they were exposed, all these groups were exposed to the 3 social stress test, the stress provocation test that is often used in research, was that after this stress test, they didn't see any specific extra activity in the amygdala, but this is what they saw in the big city group. They saw an increase, also because this is an acute stress test, which means that this urban population had a strong impact of this acute stress, which the rural population was not really suffering from. And also you see in the small town population, there was not really anything. So it seems that these big city environments with the exposures, environmental exposures and stress or whatever, makes the urban population more vulnerable and less prone to cope with stress. And yes, this was just to indicate that the cities increase the risk of depression, anxiety, and schizophrenia mostly, is I think what we've seen. It's almost impossible these days to give a presentation without mentioning COVID-19 and the pandemic that we have been living with since 2.5 years almost. And we know that I think that the number is now 7 million almost people have died from this disease. We're talking about long-term COVID and so on. Unfortunately, a number of other consequences of the pandemic has occurred. For example, WHO estimates that around a 25% increase in prevalence of anxiety and depression worldwide following the COVID-19 pandemic, for a number of reasons that are not so hard to understand. There has been a few studies published around the potential protective effect of green spaces on the mental health, COVID-19 related health issues. And we have also conducted in Catalonia a cohort study, the COVICAT, with around 10,000 participants, and also a follow-up in 2021. That we are working on analyzing the data right now. And we have analyzed the data for this first wave, but since this is recorded, I will not show it because it's unpublished. Anyhow, what we basically find is that the lack of views of green spaces is a strong risk factor for developing severe depression during the pandemic. And this is in Catalonia, where they had this very strict confinement and lockdown during the earlier days of the pandemic. And the interesting thing with this study is that we asked them if they had views of green spaces from their homes. So it was not only what we usually measure, this accessibility like land cover data or NDVI remote sensing data. It was the self-reported views of green space. And those that didn't have any views of green space from the windows, which I think was almost 20% of the Catalonian population, quite a high number. Those that didn't have any views had a 2.5 times higher risk of severe depression compared to those that had views of green space. So that seems to be a resource that is important in times of crisis. As you may have noticed, I'm interested also in translating our findings to policy and practice. And this is a colleague I've been working with, Cecil Koneinendijk, who launched this 330-300 rule based on data and science over decades, as I said. And the interesting thing with this one is obviously that this is a policy recommendation that should be easy to implement in cities across the world. And it basically says the rule is that everyone should see at least 3 trees from their window. In every neighborhood, there should be 30% tree cover. And this is important because many of these indicators are on a city scale. But we need to look at a neighborhood scale to ensure that the distribution is equal, because this is also a very common thing, that the more affluent areas are also more green. So 30% tree cover per each neighborhood. And then the WHO recommendation to have maximum 300 meter to nearest park or public green space to achieve all the potential health benefits of green spaces. Greg Bratman and his colleagues published in PNAS in 2015, a very interesting study as well. I have a background as a radiologist, so I'm quite fascinated by these pictures as well. And it gives some sort of biological insights into what could be the impacts of green spaces. So what they did a randomized trial where they randomized one group of the participants, didn't ask me the numbers, say 30 participants, that went for a walk in a green setting in a park, and the other group was walking in a built-up setting in a city. And then they looked at the participants' tendency to ruminate, meaning this kind of negative thinking, spiral thinking that you often engage in if you are depressed or have some sort of anxiety. It's basically this, negative thoughts that are not very constructive. And so they measured this at the beginning, before the intervention, so to say, and looked at people's tendency to ruminate. And after this intervention of a nature walk, there was a significant reduction in the rumination area. So this is a part of the limbic system that is activated when we ruminate. So we see what we measure is the blood flow in this part of the brain, while there was no change in the rumination in the group that was walking in an urban setting. So all these participants were from a sample of not depressed, but people that were dysthymic, so they were ruminating when they started to walk. So nature seemed to have some kind of healing impact where they stopped with the negative thoughts. Okay, so finally moving over to a little bit around my own research. I've the latest years worked mostly with childhood populations. My interest in this was spurred by the developmental origins of health and disease paradigm, which basically says that if we have early life interventions, even prenatally, we have an opportunity to improve the health over the life course, because these early life exposures are during times of developmental plasticity, so our brains and organs in general can adapt and be on a better track for better, healthier lives across the life course if we engage in early interventions. While if we don't have any interventions in early life, there's a much higher risk for poor health over the lifetime, simply because we don't, after a few years, we don't have this plasticity anymore, so we cannot really adapt physiologically anymore to the conditions. And there's been research previously on air pollution and harmful exposures in early life. But so for me, it was interesting to see what's happening if we actually provide healthy environments, if that could promote health across the life course and have a beneficial impact. Okay, so when I worked in Canada, I was leading this project that was funded by the Canadian Institute of Health Research, Born to be Wise, we called it, sort of trying to translate into a little bit of a funny way that we're talking about children being born in a condition, in an environment that is beneficial for them, for their neurodevelopment, which is what the outcome we were looking at mostly here. So in this population-based cohort, we looked at early development and used early development instruments that is distributed in all kindergartens in British Columbia. It's measuring different domains of early development: physical health and well-being, social competence, emotional maturity, cognitive development, and also communication skills. Why we would think that green spaces are health promoting as an early exposure is that the hypotheses are that children who have green spaces are this sort of nature play stimulates motor development. The biodiversity has an impact on the immune system, more about that later, and also the reduction of negative exposures. And in this study, we were mostly able to look at the reduction of negative exposures as the pathway. We also conducted within the frame of the project a systematic review of exposure to green spaces and childhood development. And we found evidence for impact on health and well-being, improved cognitive skills, improved academic achievements, reduced prevalence of doctor-diagnosed disorders, reduced behavioral problems, and so on. So this was, of course, encouraging for our continued studies. Because what we did, I said we looked at the reduction of harmful exposures. So we linked environmental exposure data to the cohort of children who had this neurodevelopmental measurement outcome when they were 5.6 years, on average 5 to 6 years old. And the exposure data contained green space, and we had a different, a little bit more specific, a little bit more accurate measurement in this one. We developed a so-called unmixed pixel greenness fraction value, which is more specific and reduced the exposure misclassification. And then we had available regression models for air pollution and predictive models for noise that we also included in our database. And then we looked at the cumulative exposure. So we looked at the average value across lifetime from birth, and also prenatally is not part here, and looked across this exposure period. So this means that we could take into account also changes in exposure depending on if the children had moved over their lifetime, and then the assessment, the neurodevelopment or the early development. And in one of the studies that we published in the Lancet Planetary Health a couple of years ago, or last year it must have been, yeah. We found that there was we found a small but significant impact on the early development by exposure to green spaces, and quite a lot of this was mediated by green spaces' capacity to reduce NO2 particularly, but also noise and PM2.5. In another study, we looked at attention deficit hyperactivity disorder, ADHD, where we saw this interaction, the joint effect of air pollution and green spaces. So it was this strong inequality. So in areas where there was a lot of green and little air pollution, there was a 50% lower risk of ADHD, while we saw the contrary, where there was only a little green and a lot of air pollution, where there was a 62% higher risk of ADHD. I only show you this because I wanted to give a kind of grand overview over everything, not everything, but a lot. I mean, so if you have further questions and what we adjusted for and so on, we can take that in the questions or you read the paper. This one, again, being happy about impact, got quite a lot of media attention, and Maria Neira tweeted about it on Twitter, the impact of the positive impact of green space and negative impact of air pollution on ADHD in children. We also did a study on autism spectrum disorder, and also there we found a small impact, a lowered risk of ASD, of autism in areas with a lot of green space, or with the increase of green space, there was a reduced risk of ASD. And all of these studies were done in Canada, so this was a pretty large sample of 130,000 children. Here we used the NDVI as exposure metric. Okay, I wanted to finish by talking a little bit about the biological mechanisms, because that is something I think we need to do more research on. I talked about the pathways, but there's still not enough knowledge, I think, around why exactly we see these different kinds of outcomes. And quite obviously, there are different pathways depending on what's outcome and so on. But one pathway that's not been investigated that much, there's some recent studies, which is very encouraging, is the testing of the old friends hypothesis, which Graham Rook started publishing about in 2010, 2013 maybe, basically saying that one of the reasons for the increase in immune system disorders over the last century is because the reduced exposure to bacteria and fungi and other microorganisms in nature because of our lifestyles and the increased hygiene levels in modern society. And this is, of course, especially important in childhood when our immune systems are developing. So what the hypothesis says, and what a couple of studies have been able to confirm, is that children who are exposed to biodiverse environments, who are playing in soil and with plants and nature and so on, they do get an impact on their gut microbiome, which is becoming more diverse in comparison to children who are not exposed to this biodiversity. And this in turn translates into impact on the immune system, which could have an impact on all these immune system disorders like allergy, IBD, diabetes, and so on. So there are a few studies on this pathway and a few on this one, but to look at the entire picture, I think there's still a lot more to do, which I think would be interesting also from a planetary health paradigm perspective, sort of bringing the awareness that biodiversity is important also for our own health. So just to give you an idea of what happened with what has happened over the last years, the last century with allergies, for example, I think 150 years ago, this diagnosis didn't exist. Here you see 1870, the first time that hay fever was diagnosed by a doctor. And since then, we have seen a constant, although plateauing, increase in allergies and also in asthma. And here in 1995, we see the peanut allergies coming as another condition. As with all the environmental studies, environmental epidemiologic studies, we can, by this, assume that there is something in our environment that is changing and that can explain this increase. All right, I will finally just mention these couple of studies as well, because I think they're very fascinating. It's sort of a natural experiment. So this is Karelia, which is a region that is situated both in Finland and in Russia. And after World War II, there was a rapid increase in industrialization and modernization on the Finnish part, but the same did not happen in the Russian side of Karelia. So what these researchers did is that they looked at the childhood population in Karelia, but then they had this sort of grouping based on which country this region belonged to. And as you see, before or just by the end of World War II, the levels of birch allergy was similar in the countries. But then with increasing industrialization in Finland, we also see an increase in the birch allergy, while nothing really basically happens in the Russian side. And this is the same picture for cat allergies. Very interesting and cool studies, I think, which would to some extent also explain or support the biodiversity hypothesis, the old friends hypothesis. This is just the diagram. Yes, so to finish, I think that what we can say is that for healthy lives across the life course, we should green the cities, work on green infrastructure, leave the children outdoors and let them play and get dirty. And thanks a lot for your attention today.